Hey guys, it's Ryan. This video we're going to continue our talk on orthodontic tooth movement, and so we talked about biomechanics and mechanics. We talked about how biomechanics can be broken down into these three components, so we're going to start with types of tooth movement in this video. So what do I mean by that? Well, we talked about how much force you can apply. You can change magnitude, you can apply light force, you can apply heavy force, and that's our F here. But the actual pressure that's felt by the PDL depends on not only the force, but also the area of the PDL that's affected by that force. So the force divided by the area over which it's applied equals the pressure. So what area of the PDL is affected? That depends on the type of movement you want to accomplish. So uncontrolled tipping is, I guess, the easiest type of movement to get. You put a bracket on the tooth here, you're pulling one direction, and the crown moves in the direction of the force, and the root moves the other way. So what I want you guys to do is take like a pencil or a pen or a highlighter or something, put it flat on your desk, and put your finger sort of right on this X here. And the X represents the center of resistance, which is a fixed point. And in the case of a tooth, it's pretty much the halfway mark between the halfway mark among the embedded root. So any part of the root that's embedded in alveolar bone, you take the halfway mark of that, and that's your center of resistance. So if you put your finger, you take the pencil and you kind of figure it out to be a tooth. You put it a little bit further down than halfway. So you put your finger on top of that and take the finger of the other hand and put it where the bracket would be, and then take that finger and push it to the left. And you'll notice how, as you do that, the crown moves in the direction that your finger is pushing, and the root is rotating the opposite direction, and it's rotating about this point. So for uncontrolled tipping, your center of rotation, which is not fixed, that depends on how you're moving the tooth, is exactly at the center of resistance, which is a fixed point. And because the tooth is moving this way, the PDL that feels the compression will be here and here, because this part of the tooth is moving to the left, that part of the tooth is moving to the right, and that's what feels the pressure. So this is not too much of the PDL, maybe about like a quarter of the entire PDL is experiencing force, and the optimal force for tipping is 50 grams. 50 grams pulling this way will apply the right amount of pressure to these two areas of the PDL to cause bone remodeling and tooth movement. Now the MC-MF ratio, which we'll talk about more in the next example, is 0 in this case because there is no couple. There is a moment of the force, which is basically anytime you have a force that's not applied through the center of resistance, if it's some distance away from the center of resistance, it produces a moment, and every moment will produce some form of rotation about some point. So if you're not pushing through the center of, let's say, your pencil on your desk, if you pushed right through the center of it, it's going to move straight across without a rotation. But as soon as you push like on the eraser end, it's going to start to rotate, and that's the result of a moment, which is a force some distance away from the center of resistance. So what about control tipping? That means we're controlling, we don't really like, in the previous example, we don't really like how that root is kind of just floating in the opposite direction. That's why we call it uncontrolled. They call it control tipping when we're able to keep that root tip from moving so much in the opposite direction. We kind of keep the root tip where it is and just move the crown. So how do we do that? Well, that's where the couple comes in. So this time you put your finger, in the same kind of area at the center of resistance on the pencil, and then have your other finger where the bracket would be, and Well, actually, here, do this. Put your finger where about the bracket would be on your pencil, and then on top, right at the tip, push a little bit lighter, but push to the right. So if you put your one finger where the bracket is and push left, and then that would cause just simple tipping. And if you put your other finger at the tip and push a little bit to the right, you'll see how it's a little bit tricky, but if you start fooling around with it, you'll start to see what's going on. The crown is moving, and you can keep the root tip where it is. And that's because the couple is rotating the tooth in basically the opposite direction that it's going because of this moment. So this moment wants to rotate the tooth. So the crown moves left and the root tip moves right. And then this couple is pure rotation force that still lets the tooth translate, but it cancels out the rotation caused by this moment. So you can kind of think of it like if you were to apply a force through the center of resistance, which is impossible on a tooth, you would cause pure translation. If you apply a force some distance away from the center of resistance, that causes some translation and some rotation. And then when you apply a couple, you just you cause pure rotation. So you kind of want to, anytime you're away from the center of resistance and you're pulling or pushing, you have rotation and translation. Translation is the desired tooth movement most of the time, and the rotation is the undesired tooth movement. So that's what you kind of want to, that's what you kind of have to counteract with a couple. And now this couple can be formed when the wire sits in the bracket unevenly. So if you're thinking, okay, I have a patient, they have brackets on, I'm putting the wire into the brackets. When you seat that wire, it kind of snaps into the bracket. It doesn't fit in passively and just slide right in. You have to bend it in and push it in with a little bit of resistance, and that snapping in and that clues you into it's not sitting in passively, it's sitting in actively in that bracket, and it causes a couple in that way. Now, the ratio here is between, I should mention, so the optimal force for this is about 75 because you're loading a little bit more of the PDL than the previous example. And where this ratio was 0, this ratio is between 0 and 1. The couple, the moment of the couple, is less than the moment of the force. And that's why the ratio is like that. And now controlled tipping is sort of the midpoint between uncontrolled tipping and bodily movement. And bodily movement's where we kind of already talked about this. We wish we could push through the center of resistance. We can't, so we're forced to put the bracket here and pull this way. We get that undesired root tip movement the opposite direction, and we counteract that with a couple. But this time it's stronger. So you can do this again with the pencil where you put your finger where the bracket is and push left, and then you're at the tip of the pencil pushing the opposite direction. And if you do it a certain way, you can get it so that the pencil moves across the desk perfectly evenly. So the whole thing is moving to the left in perfect translation. So I'm doing it. I wish I could show you like an overhead map, but if you put your finger to the right of the pencil about, say, like 3/4 of the way down, you put your finger on the right of it and push left, and then you put your finger at the tip on the left side and push right. And if you do that, you can actually move the pencil to the left perfectly evenly. So hopefully that makes sense. Hopefully you can try that and see what's going on here. It's pretty cool. And here we're loading a whole half of the PDL, so that's 100. So you can kind of see how we had 50 here when about 1/4 was loaded. We have double that when half is loaded. And the moment of the couple, and moment of the force are equal in this case because they're canceling each other out. The rotations are canceling out, so we only get pure translation. So that's why it's 1. And again, you can see how this is the midpoint between the two because we have 75, which is between 50 and 100, and we have a ratio between 0 and 1. So hopefully that makes sense because that's kind of a nice way to think about it, I think. And then torque is taking bodily movement one step further. Instead of not just moving the tooth evenly, now we want to move the root in the direction of the force. So we make the couple even stronger to push the. So you could put your fingers in the same area and then just push a little bit harder in this direction, and you can actually move the root tip in the left direction and keep the crown kind of steady. And because we're kind of back to applying about 3/4 of the loading about 3/4 of the PDL, very roughly, and that would be about 75 grams, somewhere between 50 and 100 at least. And here the couple, as we said, is stronger than the moment of the force, so that's how the ratio is greater than 1. It's also called root uprighting, and this torque is not to be confused with like the facial lingual torquing, which is like a third order bend. That's kind of different, so just try to keep that in mind. We're talking purely like how the tooth is moving. Intrusion is pretty simple. That's just pushing down because it's loading such a small area of the PDL. We only want 10 grams of pressure, otherwise we're not going to get intrusion. We're going to get other types of movement. We'll activate other parts of the PDL, so I have to keep it super, super light. And it's about 1 millimeter per month is like an average of how much intrusion you could get. I also want to go back and just mention the centers of rotation. I forgot to mention some of that. So we did mention that the center of rotation here is exactly, for uncontrolled tipping, the center of rotation is at the center of resistance. For the controlled tipping, it's at the root tip because that's what was staying stationary. For bodily movement, there really isn't one. It's kind of at infinity point, some infinite point away from the root tip because it's just moving. It's not really rotating. It's just moving straight across. So there's not really a center of rotation. And then for torque, it's moved towards the crown because the root's the thing rotating. So hopefully that makes sense. When you do the pencil and you kind of push stuff around on the table, you can see how things are rotating. And then for this idea of having one optimal force is pretty important. So depending on how you're moving the tooth, there's, here's the tooth movement, ideal tooth movement. Here's the amount of pressure you're exerting on the PDL, and the tooth movement gets better and better and better up to some optimal force, and then past that optimal force, it's kind of a plateau, and maybe it drops off. People don't really know. And anything beyond this optimal force is really not needed. So we want to keep it there. And the optimal force depends on the type of tooth movement. So like we talked about, the 50 grams for uncontrolled tipping, which also is the same for extrusion and rotation, which I didn't mention because they're kind of pretty straightforward. But it's also important to know that those are 50 grams as well. And then if you're doing bodily movement, it's 100 grams and so on. So it's also dependent on the tooth that you're moving. So if you're moving an incisor versus a molar, the molar has way more, especially if it's multi-rooted, has way more PDL area, so that force is going to have to be higher. So instead of 50 grams for uncontrolled tipping, maybe you need like 80 or 90 if there's more PDL to be compressed. So there is always one optimal force per tooth movement. Alright guys, that's all I have for this video, so hopefully this was helpful. Thanks for watching, and I'll see you guys next time.